Hey everyone, and a huge welcome to all you future nurses out there. Today, we're diving into a skill that is quite literally at the heart of patient care, assessing the apical pulse. This isn't just another box to check. It's a direct window into your patient's health, and we're going to break it all down step by step. So, what is the apical pulse really? Well, it's exactly what it sounds like. We're listening directly over the apex of the heart. The key word here is direct. This isn't just about counting beats. It's about getting the most accurate, unfiltered information about how your patient's heart is doing. It's like hearing the truest voice of the heart. And that leads to a really important question. Why do we call this the gold standard? Well, think about it. A radial pulse, the one on the wrist, it can be misleading, especially if your patient has an irregular rhythm, like atrial fibrillation, or if they're on certain heart medications. The apical pulse cuts right through all that noise. Getting this skill done isn't just for your exams, it is absolutely fundamental for patient safety. Okay, let's get into it. We'll start with Section 1, preparation. A perfect assessment actually begins long before you even touch your stethoscope. Nailing this part is your first line of defense against any errors. So let's run through this pre-procedure checklist. Every single item here is a crucial safety step. Reviewing the medical record, that tells you if a new medication might be affecting the heart rate. Knowing their baseline vitals, that's how you spot a change. And making sure your equipment is clean and working, well, that's just non-negotiable, right? This is the foundation you build your entire assessment on.
Once you've got all your gear ready, it's time to interact with your client. And these 5 steps, they're absolutely essential. Providing privacy shows respect. Introducing yourself starts building trust. Hand hygiene protects everyone. Correctly identifying your client prevents major errors. And explaining what you're about to do, that simple act can lower a patient's anxiety, which could actually give you a false high heart rate if you don't.
All right, moving on to Section 2, the procedure itself. Our prep work is done, we're at the bedside, and this is where all that anatomy knowledge and clinical technique really come together. First up, position your client for success. Supine or sitting up is standard, but here's a pro tip. Having them roll slightly onto their left side can actually bring the heart's apex closer to the chest wall, which makes it way easier to hear. Then you've got to find that sweet spot, the point of maximal impulse, or PMI. For most adults, you'll find it by going down to the 5th intercostal space and then moving over to the left midclavicular line. This is your target. It's where you'll hear that heartbeat the loudest and the clearest. Now, for the main event, place your stethoscope firmly over that PMI. You want a really good seal to block out any extra room noise. Listen for that classic lub-dub. That whole sound is just one beat. And here's the most critical part. You have to count for 1 full minute. I know, it's tempting to count for 15 seconds and multiply by 4, but don't do it. A full 60 seconds is the only way to accurately catch the rate and any irregularities in the rhythm. Awesome, you've got your number. But what does that number actually mean? In Section 3, we're shifting gears from just collecting the data to analyzing it. This is where your clinical judgment really starts to kick in. For a healthy adult, this is the magic window you're looking for, 60 to 100 beats per minute. This is the benchmark, the standard you'll compare your findings to. But remember, this is just for adults. And this table shows you exactly why context is everything. I mean, look at the range for a newborn, 120 to 160. A pulse of 140 would be a medical emergency in an adult, but it's perfectly normal for a brand new baby. As you can see, the heart rate naturally slows down as we get older. The biggest takeaway here is to always interpret your findings based on your patient's specific age. Okay, let's get our terminology straight. If the pulse is faster than the expected range, that's tachycardia. If it's slower, it's bradycardia. But these aren't just fancy words to put on a chart. They're important clues. Tachycardia could point to something like a fever or dehydration, while bradycardia might be a side effect of a medication. Using these terms correctly is how we communicate clearly and professionally. So, we've covered the textbook procedure. But real-world nursing is rarely that simple, right?
Section 4 is all about how to adapt your technique and troubleshoot some of the common problems you might run into. Patients come in all shapes and sizes. For a client who's obese or has large breasts, you can't just listen through the tissue. You'll need to gently displace it so your stethoscope is making direct contact with the chest wall. And remember what we saw with the age chart? For little kids, their heart is positioned a bit higher in the chest, so you'll actually find the PMI at the fourth intercostal space, not the fifth. This is the question every single nursing student has. You followed all the steps, but the number you're getting is way off. Or even worse, you can't hear anything clearly. So what do you do now?
First things first, don't panic. You assess. A number is just a number until you connect it to the rest of the patient. Are they feeling dizzy? Are they having chest pain? Are they confused? Think about simple things. Could their pain or anxiety be a factor? Maybe they just had a cup of coffee. If it's something like that, you can recheck in about 15 to 30 minutes. But if the rate is truly abnormal or they have other symptoms, your professional responsibility is to notify the provider right away with all your findings. And that really brings us to the whole point of this. This procedure is about so much more than just filling in a box on a chart. Like it says here, an accurate pulse isn't just a number, it's a vital piece of the patient's story. Every single time you listen to that lub-dub, you're listening to their story, and you're acting as their advocate and their first line of defense.
And of course, that story needs to be told accurately. Your job isn't finished until you've documented it. Your clear, timely charting is what ensures the entire healthcare team, the doctors, the therapists, the next nurse, has the info they need to give the best possible care. Hey, if this explainer helped clear things up for you, do me a huge favor and hit that like button and maybe share it with a classmate who could use it too. Make sure you subscribe so you don't miss out on more of these essential nursing skill explainers. And if you're getting ready for your exams, definitely check out the links in the description below for our top recommended NCLEX revision books. Thanks for joining us, and we'll see you in the next one.